Welcome to class, students. Today we'll be looking at a very important topic titled Effective Technique in Cardiopulmonary Resuscitation. Effective Technique in Cardiopulmonary Resuscitation. Introduction. Effective CPR techniques involve to perform 30 compression followed by 2 breaths, and CPR consists of repeating cycles such as opening the airway, delivering rescue breath, and performing chest compression. Opening the airway, performing chest compression, and delivering rescue breath. Effective CPR technique involves opening the airway, performing chest compression, delivery rescue breath. External chest compression artificially circulates blood throughout the body. When combined with rescue breathing, this provides oxygen to vital organs, especially the heart and brain, until a defibrillator becomes available. When to perform CPR, determine the need for CPR based on unresponsiveness, absence of normal breathing. Note: do not rely on checking for a pulse, as this method is unreliable for confirming the need for resuscitation. So that what they're talking about here is that do not rely on checking the breath to confirm if the person is still conscious or unconscious, because this method is very unreliable. Now, CPR should be administered to. Who are those people that CPR should be administered to? Unresponsive individuals who are not breathing, people that are unconscious. Unresponsive individual with inadequate breathing, people that find it difficult to breathe. So there are two categories of people that are not breathing at all. They can also be referred to as people that are unconscious, while people that have difficulty in breathing, or they don't breathe adequately. These are the two categories of people that CPR should be administered to. Important: occasional gasping in a cardiac arrest victim does not qualify as normal breathing. Now, I want to look at when to avoid CPR. Do not perform CPR when the scene presents danger to rescuers. For example, let me say it's a crime scene, or in the case of armed robbery or kidnapping cases, when people are still around, the kidnappers or the armed robbers are still around. You cannot perform CPR out there. You have to check for your own safety too, and prioritize your own self and your own safety. Yes, the scene present danger to rescuer. There are obvious signs of death such as the rigor mortis. Then the victim's injuries are clearly not survivable. We have potential complications. Rib fractures commonly occur during CPR. If you hear or feel ribs breaking, check your hand position. Continue CPR. To minimize the risk of breaking ribs, maintain proper hand placement. Avoid excessive force during compression. You have to be careful. At the other lesson, we learned how to use effective way of using CPR. So in the process of using CPR, maintain proper hand placement in the chest. Then avoid excessive force compression. As those are the things we should note why in the process of while doing CPR. Now, how to minimize the risk of breaking ribs. Note: why broken ribs reduce compression effectiveness. Continuing CPR is essential. We have regular reassessment every 2 minutes of CPR. Briefly check for the signs of life like coughing, breathing movement. While in the process, you must check if your victim is still if the person is coughing, or if the person is responding, breathing or movement. Limit assessment to 10 seconds maximum. If signs of life appear, immediately reassess breathing. If breathing has resumed, place the victim in recovery position and monitor continuously. When to stop CPR: continue CPR without interruption until the victim regains consciousness and can breathe independently. Your safety becomes compromised. You become too exhausted to continue effectively. Professional medical help arrives and takes over. So when to stop CPR is when you continue CPR without interruption until the victim regains consciousness and can breathe independently. If your victim can breathe independently and he has regained consciousness, you can stop CPR. Another is when your safety becomes compromised, when you are no longer safe in the environment. Like I said the other time, you must learn to prioritize your safety and your health. Then you become too exhausted to continue effectively. And when there's professional medical help, when people professional help comes around, you can stop CPR. Comprehension only CPR, that is the C part of CPR. If you are unable or unwilling to perform rescue breathing, provide chest comprehension only. Maintain a continuous rhythm at approximately 100 comprehension per minute. Proper hand placement: look at, you can place your hand, look at the way it's being placed. Number one. The number two, the way the hand is being folded, and number three. So you should take note of this. Proper hand placement: for chest comprehension, position your hands on the lower half of the sternum, that is breastbone. Place the heel of one hand in the center of the chest. Place your other hand on the top of the first hand. Avoid comprehension too high on the chest, it is ineffective. Comprehension too low, there is risk of organ damage and regurgitations. So you must make sure you follow the proper procedure of CPR. Comprehension techniques by age group. We have the adult and children. So primary cardiopulmonary resuscitation, you have look at call for help, check for pulse, check for breathing, check for brains. Okay, this one is give rescue breath, give chest comprehension, then repeat until emergency service. And this for children, this the CPR for children. Then we have compression techniques by age. We have the for adults, use two hand technique for chest compression, while for children under 8 years, use one hand technique for chest compression. CPR for children, we have tap and shout, check for breathing, check the airway, push hard and fast, give 30 comprehensions for the children still, open the airway and give 2 breaths. In there's a pictorial, look at it, has been seen here. When the EAD arrives, turn it on and follow the prompt. Then 7, turn on side. Then you can number 1, tap and shout, check for breathing, check the airways. Then 2, push hard and fast, give 30 compressions. Then 3, open the airway and give 2 breaths. Then 4, repeat set of 30 compression and 2 breaths again. That is step 1 and 2. Number 5, phone 911 and get an EAD, and then resume set of 30 to 2 compression, that 30 compression to 2 breaths. Then another 7, turn on side. That is how you keep doing. Then you can, when the AED arrives, turn it on and follow the prompt. We've said it for the infant. We've said lay rescuers should use two-finger technique to minimize transition time between compression and ventilation. After locating compression point, plus 2 fingers on the spot and compress the chest. Keep interruption to chest compression at an absolute minimum. Then maintain rhythmic compression. Avoid rocking movements. Then allow the chest to fully recoil after each compression. There's compression depth guideline. We have the emergency call, tap and shout, check for breathing, perform CPR, continue CPR step until help arrive. So we have comprehension depth guideline, as we have stated at the other side. We have the comprehension rate, that is 100 comprehension per minute. Rescue rotation, when possible switch rescue every 2 2 minutes to prevent fatigue and maintain compression quality, especially depth. Change position with minimal interruption to the comprehension reading. Thank you for listening.